Okay, which of the following is the most appropriate initial management for this patient? A 40-year-old man presents to the emergency department with a painful erection lasting more than 6 hours. He has no medical history and denies any recent sexual activity or trauma. The physical examination reveals a rigid erect penis with tenderness on palpation. Blood gas analysis of the corpora cavernosa reveals an acidotic, hypoxic, and hypercarbic environment consistent with ischemic priapism. Which of the following is the most appropriate initial management for this patient? I could be wrong, but I always thought this was like a medical emergency. So, surgical shunting, aspiration, irrigation valve. I would say I always thought it was like you get them in the surgery, and so I would say surgical shunting. Ice pack application, no. Oral analgesics, no. I thought this was an emergency. That's kind
Yeah.
of the whole thing with this. I thought that, so I would probably say surgical shunting.
So actually, best is going to be aspiration and irrigation. So you're draining the blood actually. Surgical shunting, I think this is like very, very definitive and pretty radical. So first you want to kind of poke it and drain the blood manually, right? With like a needle or
Okay.
something like that. And then add in kind of an agonist to kind of block that pathway. Of course, you might be asking, is this question fair for step one? Heck no, right? This is more of a step two question, right? Of course, I add these in the question bank, far and few between, but I think you're thinking on the right terms, towards step two, of course, right? Figuring out it's priapism, which they give it to you, and then kind of thinking, oh, it's an emergency because now you're cutting off the blood supply, right? And that means that if you leave it for a long time, then the penis can actually die, right? And so
Yeah.
definitely for sure you want to drain that blood and allow kind of new blood or oxygenated blood to get there.